Okay, the recording is now live. So first, I want to say thank you for your participation today. If you do not know who I am, my name is Emily Rissman. I am the Department of Corrections new Veteran Liaison Specialist. I work with a wonderful group of our colleagues who are military or veterans themselves that have formed the Military Advisory Committee. And one of our objectives over this next year is to really work on helping our staff, our family members, and our friends become a little bit more knowledgeable about the different veteran benefits throughout the state. These might be benefits at the federal level all the way down to local nonprofits. We're hoping to cover a little bit everything over this next year. Like I mentioned previously, this is being recorded and you can find it on our YouTube channel after the fact if you are not able to participate in person. So at this time, I'd like to introduce my co-host today. So I am being joined by Brian, who is the Chief of Communications and Community Engagement at the Battle Creek Veterans Medical Center. He is an Army veteran who served on active duty during the Gulf War. He has worked at the VA for 13 years, and his team is responsible for internal and external communications, outreach, donations, and volunteer programs for the medical center. Brian has graciously volunteered to join us for a few moments this afternoon to talk about the Battle Creek Medical Center, VA benefits and healthcare at large, but more specifically, some recent groundbreaking legislation known as the PACT Act. So, Brian, welcome.
Thank you. Good afternoon, everybody. I'm glad to be here, and thanks for having me on the call. I just want to start real briefly with some, basic overview of the VA and the services we provide, talk a little bit about the VHA medical centers in the state that are available to you, and then we'll talk about the PACT Act and the Compact Act briefly and answer any questions if we can. So, of course, who are our customers at the VA? And those are veterans, right? So we serve about 9 million enrolled veterans in Veterans Health Administration across the country, which is on average about 40 to 45% of the total living veteran population. So you can see kind of the breakdown by different eras that exist right now. The VA is broken into 3 branches, the Veterans Benefits Administration, Veterans Health Administration, which I am employed by, and the National Cemetery Administration. So just to give you a quick glance at kind of what happens within each of those 3 branches. The VBA, Veterans Benefits Administration, really takes care of the benefits side of things. So the compensation, benefit, fiduciary benefits, insurance, home loan guarantee, educational programs and benefits, and the vocational rehabilitation and employment section. So we do have one VBA regional office, which is located in Detroit. And they service the entire state. The National Cemetery Administration, of course, takes care of burial benefits for veterans. And we do have 2 national cemeteries in the state, one at Fort Custer, which is adjacent to the Battle Creek VA Medical Center, and the other one is Great Lakes National Cemetery in Holly, which is north of Detroit. It is important to know that these benefits are available to you and your spouse, and there are ways to get predetermination, but most veterans who served on active duty in Title 10 orders are eligible for National Cemetery burial benefits. And in case there's a question, your loved ones can call the National Scheduling Office at the time of death, and they can also, walk through that arrangement. You want to make sure your DD-214 is available to whoever may be making those arrangements at that time. But you can also go online and get a predetermination. And again, most veterans will be eligible. There is a process, though, to determine that eligibility, barring any thing happening in the meantime. The other thing to talk about is vet centers, which fall under Veterans Health Administration, but they're not really directly connected to the VA medical centers. So they operate independently, and they offer individual group counseling for combat veterans and their families, along with military sexual trauma counseling and other services, as you can see. We do have a number of vet centers throughout Michigan, including Dearborn, Detroit, Grand Rapids, Saginaw, Macomb, Pontiac, and Traverse City. But the vet centers also provide services in other areas through mobile vet clinics and a variety of tactics as well. Now, the Veterans Health Administration, of course, are the VA medical centers, and we, of course, offer a variety of healthcare benefits focused on whole health for veterans and delivering the best care possible for the veterans we serve. There are 5 VA medical centers in the state, but there are a total of over 30 outpatient clinics throughout the state of Michigan that report into those main medical centers. So we do have a variety of locations that may be closer than you think. You can see many of them on the screen. And those outpatient clinics have a variety of services, but the core services for any outpatient clinic would be, at the minimum, would be primary care and mental health care. And then as the clinics become larger in the more metropolitan areas, they often add additional specialty clinics into those as well. So let's talk about PACT Act. The Sergeant First Class Heath Robinson promised to address our Comprehensive Toxic Act of 2022 is a new law that expands VA healthcare benefits, VA healthcare and benefits to veterans that were exposed to burn pits and other toxic substances. It expands and extends eligibility for VA healthcare for veterans with toxic exposures and veterans of the Vietnam era, Gulf War era, and post 9/11 era, and expands eligibility for benefits for veterans exposed to toxic exposures. So those are some of the key things that have happened under law. And of course, the law is very detailed, as many of the laws passed are. And so just some of the key components that fall under there is expanding eligibility for health care, improving decision-making process for medical conditions and presumptive status for benefits. It added the requirement for toxic exposure screening for enrolled veterans, toxic exposure related education and training, added the requirement for some research studies around those toxic exposures in key areas. Allowed the VA to gain some additional hiring authorities to build a stronger, more skilled workforce. And it also authorized 31 new facilities across the country in various areas. So the eligibility really centers around the Gulf War area and post 9/11 for additional healthcare eligibility. So you can see the Gulf War related presumptive conditions based on service. The key areas on or after August 2nd, 1990, or on or after September 11, 2001. The law also added new radiation presumptive locations, including the cleanup of the Eniwetok Atoll from 1977 to 80, 1980. Palermo, Spain from 66 to 67, and the Atoll Air Force Base in Greenland in 1968. The adding of presumptive service-connected conditions, you can see a number of them, but around, especially for the burn pits and those type of toxic exposures, many of them go around the breathing system as far as bronchitis, rhinitis, sinusitis, but they also include a number of head and neck cancers as well, and things like hypertension, reproductive cancer, and the like. So it's a pretty extensive list of 23 presumptive conditions under the law, spanning from the Vietnam era through the post 9/11 era of service. For healthcare eligibility, in addition to Vietnam era veterans who can enroll for healthcare right now, there are special enrollment periods for certain post 9/11 combat veterans. Enrollment, of course, is free. There's no annual cost, and some of your care may be free as well. So it's always important to check out the healthcare you have earned to see what you're eligible for. Understanding many people have their own private sector insurance, which is great, but you may have some additional coverages under VA healthcare that may supplement your own private insurance or really expand your coverage for certain things. The bottom line really is if you're a post 9/11 veteran who is not previously enrolled in VA healthcare and have separated since September 11, 2001 and October 1st, 2013, there's right now special enrollment windows, and those enrollment windows expand going forward according to the law each year going back to the Gulf War eligibility period as well. So that will stagger in over the next 10 years, I believe. So the toxic exposure screening for veterans will have enrolled in VA healthcare. It's really a quick 5 to 10 minute series of questions to identify and document potential exposures to toxins during military service. And then it will repeat at least once every 5 years. And it'll be done at your primary care appointments, mainly at the VA medical centers and clinics, but it may be done in other clinics as well if you don't regularly see a primary care physician. And the screening really just helps document for your VA healthcare providers on the healthcare side, things to look at and consider in the future that might impact you based on previous toxic exposures. So remember, the healthcare and benefits operate separately, so you want to always keep that in mind. The documentation on the healthcare side does not go forward and impact your disability claims in any way. Those have to be handled separately. So how do you file a claim for VBA benefits? There's a couple ways. If you have a previous claim that now falls under one of the new presumptive conditions, you can file a supplemental claim to add to that claim now that some conditions are presumptive, and it'll be reconsidered, or you can file a new claim if you haven't filed a previous claim for one of these presumptive conditions. I always recommend working with a veteran service officer, but you are able to file claims on your own online as well. But a veteran service officer will certainly help walk through that process and making sure or assisting with the documentation and getting all the details filed into the claim. So there are also some benefits for survivors. If you're a surviving family member of a veteran, you may be eligible for certain benefits, including the VA dependency and indemnity compensation or VA DIC claims. Again, those are filed, can be filed online, and there's also, potential burial benefits. Those claims based on presumptive conditions, whether it be Vietnam or other toxic exposures, Gulf War and post 9/11, survivors who think they might have a claim based on a veteran who's passed away from one of those presumptive conditions can file again those compensation claims online, but also a service officer can and will help with those as well. And then tagged into this is the Camp Lejeune Justice Act of 2022. So many of you, of course, have probably seen advertisements from lawyers, law firms, and others seeking to represent veterans and others in litigation related to PACT Act or the Camp Lejeune Justice Act. Just know that relief awarded by a court in the lawsuit brought under the Camp Lejeune Justice Act would be offset by any amount of disability award if you choose to use one of those lawyers or law firms. So it is not, of course, required to use a lawyer or law firm to make claims in regard to the Camp Lejeune Justice Act. You can file a disability claim through VBA as well, or you can work with a veteran service officer and not have the lawyer fees attached to that. So just some of the do's and don'ts as far as avoiding PACT Act scams. You can submit your application directly to VA for VA benefits using doing it by yourself or using a veteran service officer for no charge. Be cautious of companies that claim to be contacting you on behalf of the VA or advertising VA benefits only up to your help to contract. If you're interested in working with a veteran service organization, attorney, use the Office of General Counsel Accreditation to confirm their credentials. And you can also veterans agency who can direct you to an accredited veteran service officer by calling 1-800-MICHVET or going online to the Michigan Veterans Affairs Agency. So under the don't sign a contract of authorizing a percentage of your benefits for your VA claim. Don't use forms not generated by the VA, and don't be fooled by companies that advertise special relationships with medical professionals that say they can guarantee you benefits. How or when should you file a claim? If right now they are accepting PACT Act claims, so if you think you have a claim, you can file them at any time. If you've been previously denied, like I said, you can do an amended claim or start a new claim. If you've not filed previously, you want to start a new claim either yourself or through a veteran service officer. And then just real briefly, the PACT Act, not to be confused with the PACT Act. I'm not really sure how they come up with the various acronyms when they're making these laws, but they made this one pretty similar. So Compact Act Section 201 basically states they will provide and pay for and reimburse for emergent suicide care for eligible veterans at VA medical facilities. So the benefit is for eligible veterans, regardless of whether they're enrolled in VA healthcare. So the biggest thing to remember on this is that there is a notification line, which I'll put up in just a second, that really starts the process whether you're enrolled in VA or them to determine your emergent care under this act. But the biggest thing is if you're in suicidal crisis, you certainly want to go to the ER and seek that care. Whether you're covered or not, VA will certainly look at that claim. And again, emergency suicide care can lead to the crisis care and some residential care, which is funded under the Act as well. And again, the VA emergency care reporting tool is the 72-hour notification line that anytime a veteran goes to the ER, if they're enrolled in VA healthcare, they would utilize this line as well. So it's always important to know that, as well as if you're enrolled in VA and you go to emergency room, you want to make this notification or have the ER staff at the facility you're at make the notification. But this line will also be used for PACT Act claims, whether the veteran is enrolled or not in the VA services, and they will process the claim for a payment for acute suicidal crisis. So VA healthcare benefits, you can apply again by mail, you can apply it online. You can also make an appointment with VA eligibility staff at any of the medical centers. Each one has eligibility staff, and sometimes they visit the outpatient clinics as well. So there's a variety of ways that you can apply for VA healthcare. You certainly want to look at what you're eligible for in the healthcare that you have earned. The basic documents that you need to apply for healthcare are the VA 1010-EZ, your DD-214, and your household income for the previous year. And like I said, enrollment and eligibility staff will walk you through that process, so you don't have to do it alone. Sometimes it looks intimidating. It's not that long of a form, but I understand once you look at it, there are some questions you might have. So feel free to enrollment and eligibility office at any of the VA medical centers, and they can help you through the process. And now we'll go to questions. I did have a couple questions submitted in advance. One was around service in Bosnia as a fueler for a plane, and whether that is covered by the PACT Act. Bosnia was not outlined specifically in the law for PACT Act, but it doesn't mean you don't have a VBA benefits claim. So your claim for benefits should be as detailed as possible when you submit them about the type of work you did, locations you were exposed to. And again, a veteran service officer can help fill in those details with you to make sure you're filing as complete a claim as possible. Although it's not a presumptive area or fall under the presumptive condition list, the PACT Act, there certainly could be a claim based on exposure in the type of work being done. And the other question submitted in advance was around Fort McClellan in the 1980s. And that question gets raised fairly often. And right now, the PACT Act or no other law covers any presumptive conditions for Fort McClellan. And again, that could change based on the types of claims they see from people who have served in Fort McClellan over time. And it might change in a future law. But again, if you feel there's a claim based on your service in Fort McClellan and you have health conditions that you think are related to that, I certainly encourage you to file a VBA claim.
Great. And Brian, we did get one just submitted in the chat.
The other.
Yep, in the chat, somebody asked the question, is there a C&P exam for the PACT Act claims?
So the presumptive conditions are presumed, so I don't believe those. But if you have additional claims that aren't on the presumptive list, you may have a comp and pen examination tied to those. So that's up to VBA to determine. I'm not a total expert on that aspect, but there's a good possibility you may have some other claims that aren't on the presumptive list that would require a comp and pension examination as well.
Great. If anybody has any other questions, please enter them in the chat now. Giving some folks time to do that if they wish. Brian, can you talk through what is the VHA doing to try and get this awareness out there to veterans across not only Michigan, but the entire country?
Yes, so we're doing, most VA medical centers are doing outreach events in a number of areas. I know in Battle Creek, we counted on Friday so far. We have done or have scheduled up 50 events total in this fiscal year. So we're trying to get out into different areas of the community, educate them. I know Ann Arbor and Detroit and Saginaw are doing some of the same in different areas. So we've done a lot of messaging and social media around PACT Act as well nationwide. And they're working on some different ad campaigns to engage people. And I know a lot of the veteran service organizations are doing the same. So just trying to get information out in a variety of tactics, as many ways as we can.
Wonderful. The Military Advisory Committee is definitely on board to help promote those events as much as we can. We do have employees that live in every single county across the state, and a lot of them do prefer to participate in in-person activities. So we'll do our best to share the things that you all are putting together over this next year.
Yeah, thanks. Appreciate that. And if you have questions in the future, feel free to reach out. And I think it's a lot of people just still aren't sure what the PACT Act entails or who's eligible. And I just always say, even before the PACT Act, if you're not sure, if you haven't checked before what you may be eligible for, it's a good time to do it at any time and find out the health care you've earned, find out if you may have any disabilities that you're entitled to through VBA. And certainly you want to be aware of burial benefits because all those things you have earned. So.
No, all really great points. And I don't see any new questions popping in through the chat at this moment. So we are at that half-hour mark. So again, Brian, thank you for taking some time to presenting to us, and thank you for the individuals who were able to participate live. And for those who might be viewing this after the fact, again, one of the phone numbers that Brian shared was the 1-800-MICH-VET through the Michigan Veteran Affairs Agency, and they can help connect you to the different medical centers or veteran service officers to help you through this process. So thank you, everybody, and I hope you have a chance to get outside and enjoy the sunlight.
Thanks. Have a good day.
Bye.